The following video presentation was made possible through the generous support of Innovation Credit Union.
One in 5 Canadians will develop a mental illness at some point in their life, a stat that still fails to recognize the many who do not seek treatment, and the many friends, co-workers, and relatives who are also affected. Yet despite this fact that mental illness issues affect more Canadians every year than all other health problems combined, it still receives less than 3% of the provincial health budget.
Like a diabetic can have the same, a lot of the same characteristics of the same symptoms of what my illness has, and society looks at them as being a person with a medical condition, and they are not so kind with me.
Do you know much about the Canadian Mental Health Association?
No, I really don't.
Do you know, would you say it's a government-run organization or a charity?
I'm not sure. I have not thought about it. I would hazard government, but that's probably not right.
I have no idea.
Isn't it government run?
This is why, for groups like the Canadian Mental Health Association, sourcing out funding to provide programs for their clients can be a constant struggle. Contrary to popular belief, the Canadian Mental Health Association is not a government-run agency, but rather one of Canada's longest-run non-profit organizations. While every community with a branch of the Canadian Mental Health Association hosts different programs, here in Swift Current, the association works diligently to operate a drop-in center, which provides programming for clients who are dealing with long-term mental illness. Steve and Donna are 2 members of the center who are working in the center's vocational program. For them, having the center available has been a major factor in their recovery and their ability to cope with their illness. For Steve, working in the center's vocational program has been an instrumental part of his recovery process. Having spent the majority of his life always pushing his illness to the side, Steve was too busy dealing with the pressures of moving from his Manitoba home and raising a young family to take care of his own mental health issues. A situation that eventually reached a crisis point when he retired from his lifelong work of farming.
I don't know if it was leaving the family out there and you can't see them so much, that it made me worse for a while there. Like, I really, was depressed.
It was then that Steve was first introduced to the center, which became a lifeline for him and gave the opportunity to get out and learn new skills, make new friends, and talk with others who could understand what he was going through.
They're in the same boat, and like, they know what you're talking about and you know what they're talking about, kind of thing, and I think that helps a lot.
Diagnosed at 27 years of age with a bipolar disorder, Donna says it's not hard for her to admit that she's different from everybody else. What's hard is dealing with the stigma that comes with openly admitting that you suffer from a mental illness.
People have such weird ideas about what a person with a mental illness looks like and how they behave. They just are ignorant of it.
Mental health issues affect nearly every single Canadian. Yet despite this fact that so many have been touched by it, so few are part of the solution. So how can you help? Support mental health community fundraising initiatives. Make a donation directly to the Canadian Mental Health Association, or make a donation part of your estate planning. Volunteer to give some of your time, either as a board member or simply by sharing your gifts, talents, or areas of expertise. You can make a difference.